Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hello there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. How are you?
I'm living it up.
Well, that's good news because we want our listeners to live it up also. And how you're going to do that is if you're in chronic musculoskeletal pain, that's basically orthopedic pain, you're going to call and speak to Dr. Darrow today at 866-870-5752. And I'll tell you about the free book you're going to get in a minute, but I want to make sure that you know what we're talking about. And we mean muscle pain, joint pain, tendon pain, ligament pain, disc pain, back pain, neck, knee pain, hip, arthritis pain, any kind of tendonitis, stiff joints, dull aches, basically orthopedic pain that you have been having, especially if you've been having it for a long, long time. We call that chronic pain. So when you call the program today at 866-870-5752, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies. And I want to remind you to go to Dr. Darrow's website at www.lastemcells.com. That's www.lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can watch him performing the treatments on videos. So we are here Saturdays at 10 and again at 1 p.m. And you're going to learn a lot this hour, so stay with us and jot this number down so you can call 866-870-5752. What do you think?
I'm ready to go, so I have a question lined up here if you don't mind.
Go for it.
Person writes in, I'd like to explore options with Dr. Darrow to avoid hind foot surgery, that's the back of the foot, or just having to live with the pain and hampered performance of my left ankle. I'm flat-footed, but worse on the left side. I do a full range of motion, that's good, although painful. Shooting pain and ankle weakness causes my leg to buckle and collapse at times, making it hard to wear heels or feel confident in my stride. Pain shortens distances. I can walk and exercise, but it messes up my body alignment. So a lot of issues here. And what I do for these situations, it sounds like the person may have plantar fasciitis, which is pain at the bottom of the heel. There's a little spot when someone has a diagnosis of plantar fasciitis and they come in. I just press right on that spot and they jump and they go, how'd you know where it was? Because it's what we call pathognomonic. It is the spot where it kind of speaks for itself. And it's where the spring ligament attaches to the calcaneus, the heel bone. And that's something we can generally heal. That's funny. That's a pun. By
Good
injecting the area with platelets from the blood or platelets and stem cells if people want to have a more complete, quicker healing. So I use an ultrasound for that. That way I can inject on the side of the bottom of the foot where it's not painful. Most guys who do this actually inject right on the bottom of the foot. They put a needle on the bottom. And that hurts like heck. So we use the ultrasound. With the ultrasound, we can look inside the body and we can watch the needle. It's called needle guidance or ultrasound guided needle. And if it were me, and it is me because I inject myself when I injure myself, I use the ultrasound, and I can watch where the needle goes. There are parts of the body I don't need to use the ultrasound, but things like knees, shoulders, hips, plantar fasciitis, you absolutely are going to hit a teeny little spot, and you need an ultrasound. So if your doctor doesn't use one, tell them to go buy one. They're expensive, but it's worth it for the patient and to be able to shorten the healing time, because studies show, as an example in knees, if it's a blind injection, if it's not ultrasound guided, 1/3 of the time the solution you inject will not even go into the knee joint. It's going to go into the soft tissue, which can cause problems. So be careful how you're getting injected there. So left ankle pain generally is from the ligaments. On the lateral side, it's the anterior talofibular ligament. It's the most common ligament in the body to be sprained or torn. Not a big deal. We heal those up. On the medial side or the middle side, it's the tibial tendon, and there's a few others around there that we can inject and heal that up. Sometimes we go into the joint if we think there's other things going on, arthritis or whatever. Person says they're flat-footed. I make orthotics for that. They're a little insert into the shoe. And don't buy those off the shelf. A lot of people say, well, I bought it at CVS or something like that. And if it's not made to fit your foot, it probably will not do the job that we want it to do, which is to support the arch. If you're getting a bunion, which is actually arthritis, then it's time to have orthotics made. I do inject that joint where the bunion is, but if the foot is flat, we want to do more than just inject it with platelets or stem cells. We want to also support it. I think that's pretty good. This person says when they wear heels, that's a problem. Well, when you have these feet problems, you shouldn't be wearing heels until you heal it up. So, a nice walking shoe with a thick sole is the best way to keep your foot stabilized. So that's it. Let's get some callers in here.
Okay.
I love talking to you guys. Let me handle that, Nita.
All righty.
The phone number to the studio right now is 866-870-5752. I'm going to repeat it for you, so jot it down. It's 866-870-5752. I want to talk to you. I would love to talk to you. And we have a call screening page on our computer that we can actually watch when calls are coming in. So we have an open board right now. I'd love your calls. And for those of you that are, by the way, when you call in, you can pretend it's somebody else. Or you can ask about your friends or family or something like that, so you don't feel shy about it. But if you are shy, you can go to the website and email me a question. Every page on my website has a spot to email me. And I get emails literally 24 hours a day. And I answer every single one of them. It's a big job for me, but I love talking to people.
Yay.
And if you become a patient, you get my cell phone number. And as a patient walks out the door, I always say the same thing. Don't be shy and call me if you need me. Text me. They get my email address, my personal email. Anyway, the website is www.lastemcells.com, lastemcells.com, and you can email me there. And for those of you that need more information, that want to talk to me at the office or talk to my staff, the phone number to my office is 800-300-9300. Easy to remember, but I'll repeat it again. It's 800-300-9300. And for those of you that haven't been in the office, I not only do musculoskeletal issues, which is arthritis anywhere in the body. I inject that with regenerative medicine techniques of PRP and stem cells. And when you come in the office, we decide what you want for that. I always let the patients decide. A lot of times they go, "You're the doctor, you tell me what to do." And I say, my job really is to educate you, and then you can decide what you think is best, and I'll be your coach. But I don't like telling people what to do. I think they should decide for themselves. So, feel free to call the office. Feel free to email me or call the studio right now at 866-870-5752. I also do injections on the scalp to grow hair back, and we can use platelets or stem cells for that. In my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, there's a chapter in the back with studies on how you can grow your hair back. And we also do what's called the vampire facelift, which makes you prettier. Mm-hmm. We inject the same cells, platelets or stem cells, into the face, and it regrows the collagen. So all we're doing with all these techniques is really regenerating tissue. We're regrowing tissue. And I've been doing this for over 20 years, and I've had amazing success. The first area in my body that was injured was my wrist, and I injected that the very next day. It was 50% better. I did it a couple more times, and my wrist has been amazing. I'm going to go out and play golf later today, and that's something that's heavy wrist dependent. So I have no pain in my wrist. The next thing I did was my shoulder, weightlifting injury, and I had a surgery because I was dummy back in my med school days, my fourth year of med school. My boss was an excellent surgeon, and I asked him to operate on my shoulder. He did, and it came out bad. I never blamed him. It's just what happens with surgery. And you can't really predict in a surgery how a person will turn out. I figure about half the patients who have surgery come out worse than they went in, and I was one of them. It took me a couple years to find out about regenerative medicine. I then injected my own shoulder, and the next morning I woke up pain-free with full range of motion and had 12 pain-free years after that first injection set. I did re-injure my shoulder, and it took 2 treatments the next time. So we don't know how many treatments it's going to take, but with some determination, you usually can fix what it is that's, I'm going to say, broken. It's not really broken. But we deal with meniscal tears and rotator cuff tears and things that doctors say they have to do joint replacements on. And we find that by doing regenerative medicine, we can often heal the area and save you from a needless, and I'm going to say the word dangerous, surgery. It's not simple to do a surgery. There is one woman that I was the assistant surgeon on. It's when I was in internship. I wasn't the surgeon. I was the backup dude. And a woman was getting a hip replacement and nothing special going on, and she died on the table. And I think it was probably because of the anesthesia. We never really did find out. And those kind of things do happen. There are terrible sequelae or things that can come out of surgery. So be careful. Even a simple surgery can turn out bad. And I've had people go in for a simple meniscal repair and end up with a very swollen knee that will not heal, or infections or things of that nature. So I'm going to get your pen ready and write down the phone number to the studio where we're at right now. And I'd love to hear from you and talk to you personally. The phone number to the studio is 866-870-5752. Nita, you mind if I take another question here?
Yeah, let's take a question because we have a call coming in right now. It'll take a minute for Suzette to queue it up for us.
Okay. So this one's real simple. It says, I'd like to set up an appointment, see what my options are for pain in my knees. So what is knee pain all about? There's probably 50 different possible reasons for it. So I'd need to examine that area. And often people come in with an MRI and say, look, I've got arthritis, or look, I've got a meniscal tear, or look, I've got an ACL rupture. And all of those things don't really, to me, amount to much I'm going to rely on. I like to see an MRI because it may show something like a cancer. I know that's weird, but it could happen. And there's been 2 of my patients that we did find cancer on inadvertently, looking at a shoulder and looking at the lungs one time. And it can be shocking. So it's good to get an image if you're having pain somewhere. But 99.9% of the time, I'm not going to listen to the diagnosis of other doctors. I'm going to use my own exam, and my MRI is my fingers. I need to touch the area, move the patient around, and see where their pain is really being generated from. Way too many surgeries are done because the surgeon says, look at that MRI, that's terrible. And I have so many patients that come in like that, and they go, I have a terrible MRI, Dr. Darrow. What am I going to do? I need surgery. I've been to 3 surgeons. They all say the same thing. And I start laughing after the exam, and I say, you got a great knee. You got a great shoulder. Your back is great. We just need to inject it with some cells. You do some regenerative medicine of PRP, platelet-rich plasma, or stem cells, and we can usually get them better. So let's go to Kathy. You're in Calabasas. This is Dr. Marc Darrow. How are you today?
Hi, Dr. Darrow. I am calling about my dad, who I'd like to bring in. He was hiking and hurt his arm, and they put a plate in it.
He fell down then?
It's a lot of... What?
Did he fall and fracture his shoulder?
Yes. More like the elbow area than the shoulder.
Okay. Well, the elbow and the shoulder are 2 different areas. The shoulder is the top of the arm bone, which is called the humerus, and that's a joint. And then the elbow. Okay, so the elbow is, the joint that you can bend very easily. That is between the forearm and the bicep muscle. Is that what you're talking about?
Yes.
Okay. So he fell down, hurt his elbow, fractured it. They put some steel in it to hold it together.
Correct.
And the question is, can I help him? So what's the problem right now? Is there a new diagnosis beside the fracture, or is it just post-fracture pain?
He has post-fracture pain, and he feels that, I guess, like the Wi-Fi is
the which?
Making it worse. Wi-Fi.
Wi-Fi?
Yes.
Okay. It makes his elbow feel bad?
Worse. Yes.
Worse. Okay. Well, I'm not so sure what that's about exactly. It's like when someone says, when it rains, I ache. I'm not sure about that. I'm gonna look it up after the show because that interests me to see if there's an association. I would have to touch the area and see where the pain is. Most likely, it is post-fracture soft tissue pain. So think about this. When you fracture a bone, that's not the only trauma that's going on. The soft tissue around the bone is being stretched out or traumatized also. So the bones usually heal up really well, and the soft tissue around it sometimes does not. So that's one with your father where I'd have to get him into the office and touch the area and see where the pain is being generated from and take a look at it. If you're interested, the phone number to our office is 800-300-9300. I'll repeat it for everybody else. It's 800-300-9300. So I appreciate the call, Kathy. Good luck to your dad. And I would love to see him and figure out what's going on and see if regenerative medicine of platelets and or stem cells can heal him, okay?
Thanks. Happy holidays.
Yeah, same to you. God bless you.
Thank you, Kathy. Appreciate your call. Our number is 866-870-5752 right here in the studio. Give us a call. And let's go to Hilda in Glendale.
Hilda, Dr. Marc Darrow,
Hi,
you have MS. Hi. You have multiple sclerosis, MS?
I have MS. I have arthritis on my neck, shoulder, knee, and I also have bony. I have a problem from a bottom top. But what I that my toe fingers are deforming. So do you recommend veneer surgery or not?
That's something I have to look at. There are sometimes you need to do surgery if it's too late for me to help you. So if it's cosmetic, then surgery is probably the answer. And if it's more pain-related, then I'm more the answer.
It's more, pain-related. Cosmetic.
Yeah, then I can, So I'd have to look at it, Hilda. You'd have to come into the office and let me check you out and see.
And where is your office
touch the
located,
area. I'm on Wilshire, right off the 405 freeway, across the freeway from UCLA. Don't get mad at me. Don't get mad at me. I went to UCLA for my residency, but I did go to USC for a master's in tax also. So I've been to both schools.
Okay. No, I'm not mad at you. Both my niece and nephew are physicians, and one went to medical school from UCLA and the other one from USC. So I'm very familiar with it. And
some people get real picky about what school you go to.
Call, but do you take insurance, Doc?
We do not take insurance. No. And the reason is insurance does not pay for regenerative medicine. It doesn't pay for PRP.
Good to know.
Or for stem cells.
Yeah.
If it did, I'd be taking insurance.
Do you mind giving me the phone number of your office?
I'd love it. It's 800-300-9300. They're by the phone right now if you want to call them and set up something. I'd love to see you.
Thanks, Doc.
When I was at UCLA, I did a very groundbreaking study on multiple sclerosis, and you should know about it. We used cooling jackets and lowered the core body temperature, and we found that when MS patients are when their core body temperature is cooled down, they're much stronger and they can exercise more. So with MS, I don't know if you have this, but most people with MS have what we call heat lability. When they get warm, they get weak. Have you noticed that when it's a hot summer day? What's that? Heat's your main enemy, yeah.
Heat. I cannot tolerate heat.
Yeah. So what we do is we have them exercise in a gym with air conditioning or swim in a pool with cool water, things like that. There are also cooling jackets that you can buy. They look like, the jackets that fishermen wear or jackets that photographers wear with all those pockets. You can buy one of those jackets and buy these little ice packs and fit them in there and chill yourself down. And especially if it's on a hot day, if you don't have air conditioning, you want to chill yourself down like that.
Oh, yeah. Very good. So I took your phone number, office phone number, and I would call them and then go from there. Thanks, Doc. Appreciate taking my call.
Love to see you, Hilda. The one thing about you that I love is your attitude is amazing. MS is not an easy thing to deal with. No, I mean,
let me share a story, Doc.
Yeah.
My niece is the president of neurology in California, Dr. Sharon Yagayan, and she was doing her fellowship at the Mayo Clinic in Rochester, Minnesota, a few years ago. And I went there to get to have them look at me, and they told me your attitude is amazing. I was diagnosed MS in 2002, so it's been 18 years, and I'm doing so well. But I appreciate the comment, and I try to let I don't try to let the MS manage me. I manage the MS. So
yeah, well, you're very fortunate.
I appreciate that.
You're fortunate. You probably had very good parents who trained you how to think positively. And I'm going to give you one last little pearl, as we call them in medicine. We can help MS quite a bit with an alkaline diet, because MS is an inflammatory disease. If you want to stick with me after the break, I'll finish this conversation with you.
Okay, stay with us, Hilda. Excuse me. You're listening to Living Pain Free with Dr. Marc Darrow. And you can call us at 866-870-5752 right here in the studio. And we'll be back after this message.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned. Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's